So let's learn about facility management system as per NAB standards. The FMS 1A mentions about patient safety devices and infrastructure are installed across the organization and inspected periodically. Like we see the grab bar at the patient toilet, the nurse call bed at the patient toilet, a nurse call bed at each bed. Then we have safety belts for the safety belts at the beds, the wheelchair. Then patient safety devices and infrastructures are installed across the organization and inspected periodically, like the biomarkers. The organization has facilities for the differently disabled. Has facilities for the disabled, like we have this for the colorblind and for the blinds, for the lift buttons with the braille codes. The facility inspection rounds is required to ensure safety are conducted at least once a month. Safety risks are identified during the rounds using a checklist. Organization plans and budgets for upgrading or replacing the key systems, buildings, or components based on the facility. Like you see from this picture, the facility inspection rounds to ensure safety are conducted at least once a month. Safety mats are near the electric panels. Open trench pits should be avoided. Inspection reports of the facility rounds are documented and corrective and preventive measures are undertaken. The facility reports are reviewed monthly by the safety committee and appropriate actions are taken. Evidence of pre and post correction actions are maintained at least for one accreditation cycle. Before construction, renovation, and expansion of the hospital, risk assessment is carried. The organization environment and facilities operate in a planned manner and promotes environmental friendly measures. The organization's environmental and facilities operate in the planned manners and promote environmental friendly measures. Facilities and space provisions are appropriate to the scope of services. The basis of the appropriateness of facilities and space provision will be as per the guidelines. For example, regulatory requirements directive of the government agencies like Atomic Energy Regulatory Board guidelines. Built and operated drawings are maintained as per the statutory requirement. A designated person maintains and has built and operated site layout, floor drawings, floor-wise fire acquisition plans, and others. There are internal and external signpostings in the organization in a manner understood by the patient, family, and the community. Manner implies language and pictorial signages will be bilingual and should meet statutory requirements. It's the image of the such drawings, civil drawings, electrical drawings, HR drawings. There are internal and external signpostings in the organization in a manner understood by the patient, families, and the community. Potable water and electricity are available round the clock. The organization documents it. Water testing includes biochemicals and microbiological analysis. Water should be collected at the user end tab. For water quality, refer to the current version of IS 10500. Potable water and electricity are available round the clock and should be tested at. The alternate sources of water and electricity should be made available all the times. The organization identify and mitigate the risk of interruption. DG sets, UPS units, and water tankers of alternate sources should be provided as per backup for any failure. Organization test the functioning of these alternate sources. And in case of water, or if the organization uses alternate sources, water testing of the same should be done at predefined frequency. Organization takes initiatives towards energy efficient and environmental friendly hospital, like solar power and water energy and others. Organization environmental and facilities operate to ensure the safety of patients, their families, staffs, and patient safety aspects in terms of such as safety of hospitals, especially of critical areas, are considered while planning, designing, and construction of new hospitals, and replanning, assessment, and retrofitting of existing hospitals. Operation planning identifies areas which need to have extra security and describe access to different areas in the hospital by staff, patients, and visitors. The planning process shall begin by identifying the various categories of people in hospital. At a minimum, this shall include staff, patients, and visitors in the hospital. The hospital shall have a mechanism to identify the defined categories. Hospitals have access to different areas in hospital for the defined categories as per the operational security plan. The process will give details of access to OT, ICU, including NICU, labor room, and emergency room. Vulnerable areas like dark areas, long corridors, and appropriate security is in place such as CCTV. Operation planning identifies areas which need extra security and describe access to different areas in the hospital by staff, patients, visitors, and vendors. The organization conducts electrical safety audits for the facility. The organization will condemn and dispose of the material which is not in usage, such as non-functional items, excess non-water metal, general waste, and scrap metals. Organization conducts electrical safety audits for the facility. The procedure which addresses the identification and disposal of condemned materials not in use in the organization. Hazardous materials are identified and used safely within the organization. The organization will identify and document the hazardous materials and has a documented procedure for sorting, shortage, storage, handling, transportation, and disposal. In addition to chemicals, biological materials like blood, body fluids, and are some of the other common hazardous materials. The plans shall be developed based on information provided in the material safety data sheet. The key elements shall be summarized in a manner that is easy to understand. Person who handles such materials are accordingly trained. Organize the The plan for managing spills of hazardous materials is implemented. Managing spills of hazardous materials is implemented as shown in the program for engineering support services and utility systems. There is a plans for utility and engineering equipment in accordance with the services and strategic plan. Equipment is selected, rented, updated, or upgraded by collaborative process. The collaborative process implies that during equipment selection, there is an involvement of end user, management, finance, and engineering. The plans for utility and engineering equipment in accordance with services and strategic plan. The process involves engineering, manager, user for purchase, finance, and management, copy of technical evaluations, copy of management and financial. Unique identification provided to each equipment wherever applicable. The relevant quality conformance certificates or marks or manufacturing test certificate will be retained as a part of the documentation. This includes plans for all utility equipment, facility, and furniture. The equipment is invented and proper logs are maintained as required. The documented operational and maintenance plan is implemented. Operation check is plan for water management is complement our overestimate activities. Utility equipment periodically inspected and calibrated for the proper. Person operating, inspect, test, and maintain equipment and activities. Maintenance staff is contactable round the clock for emergency repair. Downtime for critical breakdowns is monitored for reporting to inspection and implementation of quality acts. Written guidance supports equipment replacement, identification of unwanted material, and disposal. It has a program for medical equipment. Plans for medical equipment in accordance with the services and strategy. Plans for medical equipment in accordance with the services. Medical equipment are classified as per the risk. Documented operational maintenance plan for the medical equipment is implemented. Equipment is periodically inspected and calibrated for the proper. Qualified and trained personnel operate and maintain the medical guidance supports equipment replacement and disposal. Monitoring of medical equipment and medical devices related to adverse events and compliance hazard notices on risk. Monitoring of medical equipment downtime for the is monitored from reporting to inspection and corrective. Downtime for critical equipment breakdowns monitored from reporting to inspection and implementation of corrective. As a program for medical gases, vacuum, and written guidance goes the implementation of the same runs a regular test of functioning of this. The written guidance goes the implementation of procurement, handling, storage, distribution, usage, and replacement of medical gases. Medical gases are handled, stored, distributed, and used in a safe. Procedure for medical gases addresses the safety issues at all. Alternate sources for medical gases are provided for in case or in a regular test is alternate source. Operational inspection and testing and maintenance plan for piped medical gas, compressed air, and vacuum. Has plans for fire and non-fire emergencies within. Has plans for provision for early detection, abatement, and containment of fire and non. It is a documented safe exit plan in case of fire, and drills are held at least twice a year. There is a maintenance plan for fire-related equipment and infrastructure.